policy, the role of governments and policy in this space. Again, that's been one of your areas of research and expertise. Is the healthcare system and the healthcare policy of governments, say in Canada, US, or anywhere else, or globally, are they truly addressing elder care needs, or are there lacunae that you think we should be working with the governments more closely?
Absolutely, we need to be working with the governments more closely. We need good data and evidence to inform those policies. I find that there's considerable gaps in policy. For example, when we talk about India as a context, there's a number of long-term care kind of setup that is emerging, just given the need. If you look at Kerala, number of children who are outside of the country with aging parents in long-term care is high. But we don't have a regulatory framework, we don't have quality assurance, and we don't have sound policy that would then provide good, optimal care for seniors. So that will take many, many partners to work together. Researchers are one group. We need to work with not-for-profit and charitable groups that are advocating for seniors' health and welfare. They do have a role to play. Government sector have a role to play. And together, we can make improvements in terms of the policy framework that we have for providing care. That's one. The second I find is also we don't focus so much on health. We focus on care. So if we focus on health a lot more, the care needs diminishes, particularly around health care. So encouraging healthy behaviors from the outset or incentivizing those kinds of policy framework of health promotions locally and globally would be important to minimize healthcare costs. That is costly and honestly needs much, much more work as well.
Sure. In fact, I was joking last night with a doctor, a friend of mine over dinner, that I'm willing to pay a doctor to keep me healthy. And when I become diseased, he has to pay me. So that's in my mind seemed to be the model we should have. In some sense, to keep the whole population healthy is a priority. And the healthcare system itself, let's take India, for example, right? As you alluded to the Kerala example, and it's right here and now starkly in our face example. There are two directions a system can go. We create an increasingly professionalized elder care system, or create systems that rely more on the immediate social network and strengthen that social network. And like the rural example you're talking about, what is an optimal solution? The completely professionalized version doesn't sound like is a good solution, but the purely socialized, social network dependent solution also has its problems.
Absolutely, and it's not either or, it is both. We need professional services, right? People are getting education and training to be doctors, right? It's not a service everybody can provide. You have trained geriatricians who specialize on aging and aging-related diseases. So you need that vertical of professional training and education expertise. On the other hand, it is also really important to provide support and capacities for families to look after families. And that's really important because that's the first line of health when you think about it. And so providing support for caregivers, for example, in terms of training and education opportunity for caregivers would be an important consideration to think about. And so we need a whole spectrum. The aging is such a large issue that it will not be just one sector. It needs the approach of both families and kin network as well. Some don't have families, and so they rely on the friendship and kin network of support through churches or temples and other social network and systems we have. So we need to think about it much more broadly than a vertical.